Microscopic World. Discovered with GoCo Japan.
Welcome! In this video, we explore another groundbreaking research using the capillaroscope GoCo B-Scan series, focusing on dermatology. We'd like to introduce Dr. Shuntaro Saito from the Dermatology Department at Gunma University. Dr. Saito is a rising dermatologist in Japan, recognized for his promising contributions to the field of dermatology, specializing in dermatologic malignancies, aesthetics, and laser treatments. Under the mentorship of Professor Seiichiro Motegi, Dr. Saito has engaged in numerous important research projects. He is also a recipient of the Japanese Dermatological Association Journal Award, which honored the most unique and outstanding papers published in the journal during the year. Basal cell carcinoma, BCC, is the most common malignant skin tumor, predominantly occurring on the face and neck. In the treatment of BCCs, which frequently occur on the head and neck, reconstructive surgery is often required to preserve both functional and aesthetic aspects. Early detection and treatment are also crucial. However, accurate early analysis has often been challenging with traditional observation methods, such as dermoscopy. This is an example of early treatment, where a well-demarcated BCC on the right nasal ala was excised with a 2 mm lateral margin and subsequently reconstructed using a VY advancement flap. In this paper, Dr. Saito highlights that capillaroscope not only offers the advantages of being non-invasive, easy to use at the bedside, and providing rapid results, but also shows potential as a tool for the early detection of small BCC. These images were provided by Dr. Saito and were taken of small BCC on the left side of the nose. In the lower left of the screen, you can see an image of the BCC captured using traditional dermoscopy. The white arrow points to a short fine telangiectasia, which are fine blood vessels less than 1 mm in diameter. This video was captured at high magnification using the GoCo B-Scan Z capillaroscope. With the capillaroscope, the previously fine-looking capillaries appear larger and branched, taking on a tree-like structure. Additionally, twisted vessels can be observed around the pigmented nodules. By using capillaroscopy, both pigmented structures and vascular structures can be more clearly identified. This means that even small diameter BCCs can be detected early, potentially leading to reduced surgical invasiveness through early treatment. We express our respect for Dr. Saito's remarkable discovery. Thank you for watching. Now it's your turn. Please join us today and take advantage of GoCo's capillaroscope.